First of all, I apologize. I am tired. It's like 6:19 p.m. My neck hurts. Oh. So one day I will say, I had to fix my posture. Oh my, I can't even think. The reason why I say that is because my neck been hurting, right? I know it's from anxiety, but here's the other thing. When I started experiencing panic attacks back in 2016, right? 2016, and then by late 2017, I realized, oh my God, my body's always aching. Even when I don't have the symptoms, the panic attacks, I didn't have panic attacks 24/7. I'll have like maybe an hour or two, sometimes different amount of times without anxiety. The thing is, when I have no anxiety, no panic attacks, my body is still in pain. So I still wouldn't leave the house at the time, right? But I realized that I'm always like hunching down. So I see right now, I'm like looking straight, right? My neck, like I'm perfectly aligned to what I'm staring at, right? But I always have this thing of like, forehead posture, like you're always looking down like this. And so I have that curve on my neck and it hurts. And, I realized, oh my God, my dizziness might not be coming from my brain. It might be coming from the back of my head. So when when I don't feel dizzy that much, my my neck and my ears doesn't hurt. Like my ear don't feel full. The back of my head don't feel tight or tense. It's because I'm sleeping. Like for example, when I sleep, I have this thing of like t- turning my head, extending my head 2 inches out as far as I can. Because for whatever reason, I cannot sleep straight. And when I sleep with my girlfriend, when she's over at my house or when I'm at her house, she's always correcting the way I sleep. What I mean by that is when she see me sleeping like not straight, like hunching down, she'll get upset and say, "Look at the way you're sleeping. Your head. How are you comfortable like that?" And then I wake up in pain. Now, keep in mind, my panic attack just slowly came back a couple months ago, maybe 4 months ago or so. I want to say 4 or 5 months ago or something. I don't remember, but when it came back, it wasn't like every day I was getting panic attack. It was like every few weeks, every week or two, every few days, I'll get it. And then, by October 26, 23, I would get them again daily, 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 like every other day, every 2 or 3 days or so. And then last month, January, um, I started getting them more frequently. And now February, what's today anyway? Today is the 3rd, right? And I went to the doctor this morning. I had a doctor's appointment at 9:45 a.m. This Saturday morning. I booked it on Monday or Tuesday because I wanted to talk to them about the dizziness, and then I told them it's coming back. And then he gave me some medication. I forget magazine. I forgot. I can't even pronounce it, but and he did some testing on me, like closed my eyes, did my balance. He said my ears look perfectly fine inside. I told him sometimes I feel like there's fluid dripping out my ear. He said he just looked in, he didn't see any fluid. And then here's the thing, fluid is clear, so I don't know if you can see it, because when I can feel it, and when I put my finger on the tip, I can feel it, and it's just clear. So I don't know how the microscope will see it or not. I don't know, but he told me take the medicine only when I feel it the worst, especially at night, because I can't use heavy machinery if I use the medication, because it might cause drowsiness. It might even make me dizzier. Right? So he said if I take it, because I told him sometimes I don't feel the panic attack, but the dizziness throws me into a panic. And saying, well, this medicine is mainly for vertigo, off balance, dizziness. Um, if if it takes the dizziness away, it might take the headache away because I told him I get the headaches with the dizziness. And then it throws me into a panic. He said, well, if your dizziness is causing you to have panic attacks and the headache, so if this medication takes that away, you might have little to no panic attack. But if it makes it worse, or it doesn't help, he will refer me to an ENT. If the ENT checks my ear, my throat, nose, every sinus, take a deeper look inside my ear, and he said there's nothing wrong, then the ENT might send me to get MRI neurologist for my pain. I've been wanting to get all the tests I can do because I'm thinking to myself, okay, if I don't have a tumor, because I don't get headaches every day, but when I do, it's the panic from it, then at least for sure I know it's from the panic attacks, just to rule anything out. Because what if they don't catch something? That's in my mind. I'm not saying doctors are going to be perfect, but if one doctor catches something else the other doctor doesn't, that will make me, if he say, oh no, you're if he say, oh, you when I look in your ears, I can tell there's something in your ears, but it's nothing dangerous, but we can fix it by, like, either removing that from your ears or whatever it might be. if if we can take the dizziness away from me, I'll be so much happier. The dizziness is my number one thing. The neck pain and stuff, yeah, bothers me, but if I don't have the dizziness, the headache, I will be so much better. The neck pain, the body pain, it doesn't really bother me as much. But the oh, so when I went to the doctor, I told them, um, when he did the balance test, he told me, maybe I should. He, he said your balance looks fine, and then I'm like, well, at the doctor, I feel dizzy. I told him. He said, you might be dizzy from your darts, like your darts are all over, and then your brain is like haywire, like your brain, there's too many darts, and your brain is like doesn't know what to do, so it makes you feel dizzy, but you're not actually dizzy. Because if you were dizzy, you wouldn't have been able to walk in that straight line like I asked you. You wouldn't be able to put your foot together, close your eyes, and I barely even move. And he did it for me to see how he does it. He says, see, look at my legs. When my eyes are closed and I put two legs together, I'm going to have a little balance failure too. My nose stuffy. And, I'm hoping. So before I went, I took a self test for COVID, and I didn't chose negative. So, that's a good thing. But there's so much things I want to tell the doctor, but sometimes I feel like they just want to see you real quick and out the door. Because since I've been to this doctor, I never took any blood tests. Only at the ER and the heart doctor. He's the only one that ever did any blood tests on me. So, I can't wait to go see the heart doctor to do a checkup on ultrasound on my heart. I don't know if I mentioned that I had wearing heart monitor for 1 week. I took it off last Sunday, and I have a doctor's appointment, 2 more doctor's appointment with the heart doctor in about 2 weeks, 2-3 weeks from now. So he's gonna do an ultrasound and tell me results, the results of my blood test. So I'm pretty sure the blood test came perfectly fine, because otherwise, if it wasn't, they would have called me by now. If you have a blood test and you're waiting for the results, the doctor will tell you. If it's something bad, they will call you as soon as they know. So, that's one thing, never worry about your blood test. If they say, oh, we'll talk about it on your appointment, but if they call you sooner, then but I'm not saying you should just sit there and worry about it. I do the same thing, I'll be honest. The other thing that I didn't get to talk to a doctor about is it's hard for me to like show where, but this area of my head, I have like a bump right there, and when I get a headache or when I'm poking at it, I can feel it. I can feel it. I can really feel like it's like my scalp hurts. I did talk to a different doctor at the office before, at the same doctor office, and she said she looked at it, touched it, and like kind of poke around. She said this it's it's like acne like skin, so maybe better. So she told me try to take a medication, shampoo medication. She said, oh, it could be from your anxiety, your stress, and then the tightness is just squeezing. And I told her, when I didn't have anxiety, it went away. She said, because you're stressed out, the blood in your throughout your body sends you into a lot of symptoms and sensation. And then she said, let me ask you this. When you don't have anxiety, you don't have any of the symptoms, right? I said, yes. Do you have negative thoughts? I said, no, I don't have much negative thoughts now anymore. And then she said, do you know why? I said, because I'm not focusing on it. I'm focusing on what I'm supposed to do. And she said, if you have a panic attack, what do you do? I said, I focus on the anxiety symptoms, the sensation. She said, okay, when you focus on your dizziness, do you feel dizzier? I said, yes. And said, okay, if you're dizzy and you get up and you walk, are you able to walk straight? I said, yes. She said, there you go. You're focusing on it, that symptom so much, you are making yourself feel dizzy. And sometimes I feel like, oh my God, I'm probably not even dizzy, but my mind is, it's like wasting darts, like I'm waiting for it, and then I visually think I'm dizzy, but I'm not. So I encourage a lot of you guys too. And you ever feel vertigo? Slowly get off your bed. I'm not saying quickly jump off your bed, right? Look at one spot if you can. Look at a spot that is eye level with. If you're sitting, look at the eye level with you. Just focus your eyes on it, and then if you're standing, focus on the spot without like tilting your head up and down. Because for me, when I look over quick, my heart was jumping beating. It's like because my eyes and my balance centers can't catch up with each other. So if your room is a mess, like mine is, I'm not gonna lie, I need to clean my room. It might be dust, all that stuff can also congest your nose. I'm not saying cleaning your room or organizing everything's going to take care of your anxiety. I'm just saying, sometimes when you have too much things to look at your room, like my room, there's too much things for me to look at, and then when I get dizzy, I'm like I don't know what I want to look at. If your room like it's neat and organized, you don't have that much things to look at. Who knows? Your eyes might just focus on one thing, because with anxiety, dizziness, you start like, I want to focus on this, and you want to focus on that, and then next thing you're like this all the time. Anyways, that's pretty much it for me.